Brian Ramos. I'm going to be completing your abdominal exam today. We're going to do a series of tests and I'll explain them all through. I'm actually going to need you to lay down all the way flat. You all right? Are you hurting at all?
Nope.
Okay, perfect. Well, I guess I'm gonna have to kind of bend down here because I don't have a tall exam table. So first I'm gonna have you lift up your shirt, but I want your arms exactly like that, folded over your chest like that. Perfect. Can you go up a little bit more with your hands? No, not with just your hands. Thank you. Okay. I'm gonna put my paper here for a second. So first I'm going to inspect your abdomen. Just from the look of it right now, it looks nice and flat. I don't see any visible peristalsis or aortic pulsation. It's not concave and it's also not protruding out. I don't see any scars. There's no striae. There's no rashes or lesions or any dilated veins. And your umbilicus looks nice and midline. There's no bulges at all. So the next thing I'm going to do is move on to bowel sounds. First, I'm going to use the diaphragm of my stethoscope. And I'm going to listen to your 4 quadrants along the midclavicular line. Okay. I'm going to listen for about 15 seconds each. Okay, perfect. Your bowel sounds are, they're in all 4 quadrants. They're normal active. I would not say they're hypoactive or hyperactive, which is good. Now I'm actually going to listen for friction rubs over your over your liver and your spleen. I'm going to use my diaphragm of my stethoscope. So first I'm going to listen over the liver. And then the spleen. No friction rubs present in either area. Now I'm going to listen for bruise over your important arteries. We're going to start with your aorta, renal, iliac, and femoral arteries. And I'm going to use the bell for this. So starting with the aorta. And then moving to your left renal artery. Right renal artery. Your iliac artery, or your left iliac artery. And your right iliac artery. And for the purpose of this video, normally I would listen directly on the skin at your femoral arteries, but for the video, I'm just gonna listen over your denum. Okay, no worries present. Next, I'm going to listen for venous hums. I'm going to also use the bill of my stethoscope. And I'll listen in the epigastric area. And directly over the umbilicus. Perfect. Now we're going to move on to percussion. We're going to do all 9 areas. All right. I'm going to start, I guess, in the right iliac region. This is where I don't know if you remember from our respiratory exam, but this is where I tap on you with my finger, directly onto my other finger. Okay. Perfect. Oh, let me do the last 2. Perfect. I heard tympani. Now I'm going to percuss over the liver. This is where I'm going to start in the lower right quadrant of your stomach and move upward. But I do need to grab my ruler and my pen for this one because I'm going to mark where I start, and then I'm going to mark where I feel, or where I percuss over your liver. And then afterwards I'm going to measure. About 16.5 centimeters. Okay, now I'm gonna percuss over your spleen. Before I do this, I'm gonna have you take a deep breath in and hold it. I'm gonna do this at the anterior axillary line, the lowest interspace. You ready? Take a deep breath in for me. Perfect. Thank you. I heard tympani. Making sure I'm not missing anything on my list. Next, I'm going to do light palpation. This is where I'm going to start with one hand, and then afterwards we'll do deep palpation, okay? Any pain or tenderness with that?
No.
Okay, now I'm going to move on to deep palpation with 2 hands. Here's a dog snoring. Okay, no masses or bulges noted. Did you feel any pain or tenderness with that?
Nope.
Perfect. Now I'm going to palpate your liver. I'm going to do the hooking method though. So let me find your ribs. Okay. So for this one, I'm going to have you take a deep breath in and I'm going to palpate upward kind of like that, okay? Ready? Okay. One more time. Oh, go ahead. Release. All right, one more time. Okay, now release. Okay. I felt slightly the liver's edge. Now I'm gonna palpate your spleen. I'm gonna do the bimanual technique where I put my left hand over on that side, and then I'm going to palpate upward with my right hand. So this one, we're gonna have you, or I'm gonna have you take a deep breath in and out. When you exhale, I'm gonna start pushing upward, okay? Go ahead. Okay. I do not feel your spleen, which is good. That means it's not enlarged. All right, so now it looks like we are on to the next section. Next, we're gonna focus on your kidneys. So this is the portion where I actually need you to sit up. And if you don't mind sitting on this chair, but face me. I know that seems kind of silly, but we need to see your back. I need to see your back. Perfect, that should be good. So I'm going to palpate your kidneys. In order to find them, I do have to look right about here. I'm looking for the vertebral angle, and then it's going to be on the left and the right. Okay, so here's the vertebral angle. So then it will be on the left and the right. Do you feel any pain or tenderness?
No.
Okay. Next, I'm going to do the CVA tenderness. So this is where I'm going to put my hand on top of each kidney, and then I'm going to have like a blunt motion towards your kidney. If you feel any extreme pain or tenderness, just let me know. You ready?
Yep.
Are you okay?
Yep.
All right, I'm gonna do the other side. You all right?
Yep.
Okay, perfect. You can throw your shirt back on if you'd like. We're gonna move on to the next special test. I'm actually gonna have you lay back down. Thank you, sir. Now we're gonna do some appendicitis tests. I'm gonna have you lift your abdomen back out again. Perfect. So this is the one where I'm gonna push on your left side, and you tell me if you feel, where you feel the pressure or pain, okay? Or if you have any pain that radiates anywhere else. Ready?
Yep.
Did you have any pain with that?
Nope.
Okay, so that would be a negative Rosping sign. Now we're gonna do the psoas sign. So this is where, can I have you straighten both legs out? Perfect. I'm gonna put a little bit of pressure on your right thigh above the knee, and I'm gonna have you lift up against my resistance, okay? Just with that right leg. You ready?
Yep.
Go ahead. Perfect. Any pain with that?
Nope.
All right, that's perfect. That means there's a negative psoas sign. Now we're gonna do the obturator sign. This is where I'm going to lift your leg up right here, and we're gonna flex your knee. Flex your knee. Okay, you ready?
Yep.
I'm gonna move it to the side and in. Side and in. Any pain with that?
No. Perfect.
Negative sign. Now we're gonna do the cholecystitis sign, which is Murphy's sign. This is where I'm gonna palpate your liver edge while you're taking a deep breath, kind of like what we already did. And then we're gonna watch for any sharp pains that are noted when you stop inspiration. You ready? This is where I'm gonna hook the liver again. You ready? Take a deep breath in and out. Okay. Any pain or tenderness, sharp pain with that?
Nope.
Perfect. Alrighty. Well, that concludes our exam. Do you have any questions for me?
Nope.
Perfect. Thank you.
Thank you.
You can put your shirt down.